to be a short cutaway, just to not only recap the morning, but to get you familiar and maybe not familiar with this, because we are growing. Like to really look out and see where this place has come over the last few years. To look at this entire room, every seat filled, and in some of our sessions to have standing enrollment, right? That's a real credit to just our overall growth, but the ability for us to be where we need to be, to be active, just shows the possibility. So anyway, chance for us to reflect on this morning, hear directly from some of our team members. We are joined this afternoon by some of your peers, some of your teammates here, and to bring their perspectives into how Vann is moving forward, clinically, operationally, and strategically. But what makes this panel today very powerful is the fact that it's about their specific insights, right? Nobody is one message, right? We're not quoting the mission, right? These are individuals that believe in the work that they do. They come from varied backgrounds and experiences, and the work that they do every day really makes us who we are. So today we're joined by Dr. Kelcy, who's the Assistant Vice President of Value-Based Care and those contractor programs. Santiago, who's our Assistant Vice President of Facilities. Shalanda, who's a family nurse practitioner. The bird. Let me take some liberties here. All too often, and I will say this, right? We are hyper-focused on our longest-standing sites, which have always been in Wake County, right? Some of our just traditional sites. But Franklin County is, I believe, our calling card to everything that is going to be in our future. As that county evolves, as that county represents our highest density of rural populations and rural space, but the team that has been built there in the last few years, and now your new digs, right? Everybody likes the new space down there. So that speaks volumes that Shalanda got a little shout out there. And then our own Chad Goldman, who is the Assistant Vice President of Information Technology, helping us stay online, resetting passwords. So let's start right in. Panel discussion questions for the day. We'll center around reflecting on the morning themes, translating lessons into action, leadership and belonging, looking forward to the future. So I'm going to start with the fan favorite. Or the bird. So Shalanda, this morning we heard powerful messages on equity, collaboration, and innovation. From your perspective, as a provider, as a clinician, right? Someone part of our ACH family, what is one thing from this morning that stood out to you? And why do you think it's especially important for this organization?
Yeah, I think what I've noticed as the running theme is tapping into our individual strengths for collective success. So I feel like already many of us have taken one thing away from this morning's session on, what we can do better in our respective roles. So yeah, just continuing to grow and develop individually for the improvement of the organization and the community.
Excellent. Rich, tapping into some of that collective success theme from this morning, what do you think is especially so important? What is especially important for ACH at this time?
For us? Am I supposed to turn this on? Okay. I need Chad to help me with all the situations. As we continue to grow our organization and the expansion that we're going through, I think that's going to be key in our growth and where we're heading this organization. And also, the additional services we're bringing in, X-ray, radiology, services, and potentially as we go down the line and talking about that, some additional services.
Good stuff. Chad, same question.
So one thing that stood out to me this morning was, and we talk about language barriers a lot, but it didn't really impact me until this morning when I heard about literacy barriers of people not being able to read and write. So how can we find, like, from my perspective, a technological way to get patients, like their ABS, maybe audio, or something along that line, like that? I don't know, it just came to mind in the moment, but so I don't know if that's exactly possible, but that could be a potential solution to bridge that gap.
That's a good place. And I think a lot of times we've been so diligent on meeting people where they are. I think that digital divide is felt even more so in healthcare, right? Thinking about us as hub and spokes and where we connect people to, ensuring that we have good platforms, we have good backbones here, and technology, but also how our partners interact with our patients when we refer them out for some of the issues that they may have. Dr. Pope, same question. What's important for ACH right now?
I think one of the things that, for me, that stuck out, the undertone was that we are one body, but we're all different parts. And it's important for us to lean on each other, you know, and respect each other's roles, and everyone has a role to play in this incredibly, not only life-changing work, but life-giving work to some of our patients.
You worked with that tagline. I think it's ultimately important. I love the theme of knowing the role toward this collective success. And I think it's important for each of us to understand, it goes back to the theme of the day, you know, the power of you within your role, right? And understanding that the expansion of that role will be on your title, right? And how we collectively can morph and become flexible, and that respectability piece, I think, is key, right? That we are people, right? And we are professionals, right? And even in an organization like this, there's some hierarchy, but we have to be willing to understand that we're meeting people where they are, right? No one in this organization, this is just an example, title aside, gets beat up more than Rich. No, I'm joking with you. No, than me. About everything that we do. And it doesn't matter about a title. I'm an ACH family, right? And my responsibility is to make sure that we're going in the right direction, because I have to be able to listen. I can't always get everybody's stuff done, right? But collectively, that's why the collective impact piece internally is key to our success. And where we need to be right now, the purpose of the day is really to get us all on the same page again for growth. Because there has been so much growth, and it's happened so fast, right? So many things are coming out. Sometimes it's just good to get reset and understand who does what and why. And all of us understanding where we're going in the next couple of years. We just completed our strategic plan. And that strategic plan is literally for like 2 years. It's not no 10-year plan, right? It's 2 years. The work that we're constantly doing, the work that we have to get done short-term, long-term. So long-term in the business that we're in is 24 months, right? That's it. So that means we have to be super, super diligent, focused, right? And understand how we measure and execute together every single day. Every single day. Second question. How we translate lessons into actions. Professional development is only as strong as the action we take after it. Right? So when we leave here today, right, what does it really matter if we don't put it into work? Okay? Dr. Pope, how do you see today's learnings translating into our work every day across departments, whether it's clinical excellence, teamwork, or serving patients more effectively?
I think it's important that we have some intentional awareness of roles across departments, no matter what function one may be engaged in. So being intentional about our awareness. Also being open to feedback. Sometimes feedback is not always easy to hear, but if you have a will to grow and evolve, it will help you. It will help me. So I think it's important that we are aware of our intention and how we are collaborating across departments, who needs to be at the table, and just being open to feedback without fear of retaliation or, for there being a negative impact. It's really for our good. As an organization, it's for our good.
Great. Rich, same question. How do you see today's lessons translating into our daily work across all departments?
So for the classes that I counted today one of them was, the team-based care. That's something that I found very interesting in this particular. It was very interactive. First of all, they did a great job. And Dr. Pope did a great job answering one of the questions about interdisciplinary teams and how we're starting to institute it at Beacon Point and which members we may need to add as we go along through that process. But one of the other things that I was learning about is like, you hear about it, but you don't really understand silos and how we, like you mentioned Lewisburg, we got 14 locations, and in 14 locations, we're operating slightly different because it's based on the population we're serving. And I think this is an opportunity for everybody here to understand that although we're operating slightly different, we are all the same, and the one message we need to continue to bring in is our patient care and driving that patient care, and really emphasizing on providing the best service that we can as an organization, because we are patients ourselves, and we want to continue to treat people in the same fashion. And as an organization, we also have to continue, as you have started, with recognizing all the employees. There are some things that I learned from this that I'm going to share with the management team that would be beneficial to continue to engage employees so that they can continue to provide the highest level of service.
Shalanda, same question.
So to me, that looks like using trauma-informed care language and providing care that is empathetic, that listens, that's calm when you approach certain people. That also means when it comes to safety, we're double checking behind ourselves. We're putting in processes to improve those aspects. We're reviewing our data and seeing how we can, improve on those things. And then that also means confirming that we have the right supplies, being aware of certain medications with contraindications when we're ordering things pharmacy. But also doing that interdisciplinary collaboration where we have those short huddles where we are communicating with each other, so we're on the same page, and doing more of that so that we get collective feedback. So.
Great stuff. Chad, how do you translate today's work into our daily work and events?
So in this morning's session with the health equity, they were talking about speaking to patients in plain language. And I think, my department has a lot of acronyms and technological words, just like the medical field. And I think, internally, we need to remember that not everyone else is a IT person. I think that also that language barrier translates across the board. So I think treating each other with empathy inside the organization will also go a long way.
That's a recurring thing. And that's a session in itself. I think the power of each of us is the uniqueness that we bring, how we deliver messages, how we walk, how we talk.
Yes.
Some of us talk hard, some of us walk hard.
Yes.
That's why my shoes lean, because I walk hard. But that should never come across as, either offensive or defensive, right? We have to be willing to accept where people are coming from. We take the time to get to know a little bit about where people are coming from, right? Not being nosy. Sometimes that helps, gets us to, in the receiving end, to truly understand. Maybe that's why that person is coming across like that, right? But empathetic, that thread of being empathetic across the organization, we've heard that for quite some time. And I'm trying to tell you, the pivotal moment is today, because you look next to you, you look across the room, across these tables, there are tons of people that you are not going to interact with every day, right? But that same amount of people are people that are going to help make you successful, that have a hand in playing a part in the success of this organization. So I said this a long, long time ago. It's just about being nice. It's just having manners, right? Manners and being nice and asking the right questions, right? Not taking it personally and respecting the value of everyone and what they bring to this tremendous organization every day. Easier said than done. Easier said than done. And sometimes I have to think about it myself. And I said, Scott, if you weren't the CEO, right, would people smile? Right? If I wasn't the CEO, sometimes maybe they would smile more. Because everybody doesn't always smile at you, right? But what would that real conversation be, right? And I take myself out of that position every day and say, would I be willing to interact and work with people and get stuff done? Because that's what I always challenge each of you to do. Find something here every day that needs to be fixed, right? But when you find something that needs to be fixed, what else are we doing? We're bringing solutions to it. It's easy for me to point out something and say that's wrong, right? But it's much more difficult for me to say, that's slightly off kilter. What can we collectively do to make it better, right? And that's what we should be in the business of every day, ensuring that that patient has come in with an ailment, an issue. How can we fix it, right? Everybody along the track has expertise to get that patient to a state of what? Wellness, satisfaction. The same thing within our processes every day. It takes one person to impact another person. Those two people impact 4 people, 5 people, right? 50 people. We play a role in that. One sour interaction. Do you know how much a sour interaction at the coffee pot will do to a department or a site in a day? I don't want to veer off too much, but I'm just saying. Do you know how much, like, a hello that comes back with another response that was quite like, did he say hello? Or did she say hello? Did you hear it or not? Because if I think you didn't say hello after I said hello, we have a problem. Right. Am I right? Yeah. Come on, Lewisburg, y'all were real loud earlier. But it's the truth. It's the truth. It's the truth. Great responses. Question number 3, leadership and belonging. I continue to bounce around a little bit. So at ACH, we often talk about belonging and leadership at every single level. What does that leadership look like at every single level? These are really great questions. What does it mean for you to lead, to our panelists, in a way that empowers others? And how can each of us, no matter our role, step up into leadership moments day to day? What does leadership look like to you in advance? What should it look like to you in advance? And how can you, amongst your family, how can each of us play a role in stepping up and being leaders every day? Rich?
For me, it's my ethics, honestly. I believe in stepping up to do everything that needs to be done. If that means I have to get down and address something, in the sense that I am leading by example. And that's one of the key pieces of what I try to do here. Most staff don't know me in this appearance that I am now. I'm usually in a scruffy uniform, getting work done with my team. And I try to empower my team to try to move forward and try to address things, although for some, it may not feel like we're addressing things, but we've grown from 7 locations when I started, and thanks to the executive team, we're at 14 locations and potentially 3 more locations in the new year coming. So as I move forward with my leadership goals, I continue to think about something that we, as an organization, had instituted a couple of years as being in service, which you have mentioned on Martin Luther King Day. So that's kind of how my philosophy has been. I'm going to be in service, and I'm going to be that person that's going to step up at all times to do what needs to be done. But also listen, and I encourage everyone here that you're the eyes and ears of this organization. So when you're there and you're in the clinic or you're in an environment and you see a process or something that needs to be changed, something that needs to be addressed, don't keep it to yourself. Share that information. Management is open to hear it. Even if it seems like it's not important, it may be important to our clients and to ourselves as employees, because we live in this space most of our day. We just go home to sleep and take care of the rest of the business. So.
Same question around leadership and belonging. Shalanda, what does leadership look like to you here? What does it take for you to lead every day? And how can your peers step into the leadership positions and take some responsibility every day?
Yeah, so leading in a way that empowers others to me means modeling a path that other people want to walk with you. And so when I think about people who have done that well, I think about people like Martin Luther King Jr., Barack Obama, Steve Jobs, Oprah Winfrey. And so the thing about them is they have genuine empathy for others, they invite others in, but also inspire others to reach that shared vision. And so with that comes authenticity, treating others how you want to be treated, and then meeting them with real understanding, being open to feedback, holding yourself to a higher standard, and accountability, not just for your teammates, but for yourself as well. And that's being accountable to your commitments as well as your weaknesses. And so that can show up every day in mentoring a new colleague, listening to a patient or a teammate's concern, spotting an inefficiency, but also offering a solution to improve that. And so I think the main thing is that, you know, as it's been said before, leadership is not a title, but it's more so a practice, something that we can all share in. And so, every interaction that you have with someone is an opportunity to elevate them. So.
Very good. Thank you.
So it's interesting having been here just over 6 years now and seeing the shrinking we had initially, right? Our staff shrunk, but now we've grown more than double from where we used to be.
Was that when they were running out the door when I first got here?
You're a little scary.
Go ahead.
They also again you walk in the door. So anyway, I tell my folks all the time that growth is good, right? Growth leads to promotional opportunities, growth opportunities for all of us. You know, we get to wear some more hats, which doesn't always feel great, but it serves the organization in the long run, and it helps all of us grow. And so for me, I've been here, like I said, just over 6 years, and I've been through a couple of promotions now, and that made room in the department for another promotion internally, so I think that's all good stuff.
Leadership and that growth, modeling accountability, I heard that. Mentoring, that piece of it. Those are all characteristics of leaders. Communication, holding each other accountable, right? Not only ourselves, but each other. Rich talked about, you know, his team and the work that they do and roll up their sleeves. I think about that department specifically and how it is a department that you never know things are happening until you either see things happening or something is broken, much like IT, right? So those are departments that kind of go in as like unseen sometimes, you know, and unknown folks. The one person I think on Rich's team that people are getting me confused with is Mr. Bell. So I want to take the time just to say, I don't know his name. He was hired, I don't know. But he is not me. And I actually feel some type of way about this Twitch thing just because he's a black man with bald head and hair. And we're not the same height. He actually wears thick sole shoes. No, it's all good fun. It's all good fun. No, I just want to address that because I've been hearing that a lot. Dr. Gold, same question.
I think it's critical that we build trust. We know how important trust is, whether we're on the job or in our daily lives. And so it's important to build trust. We know that sometimes employees, staff, our ACH family, they come in with things. And so there may be a moment where, you know, someone may need to vent or someone may need to share something with you. And it's important that we establish that trust and work hard to not break it. Inviting collaboration is important. I think we talked about that at Lynn. But I would say also, if someone gives someone a task, allow them to own it without doing too much stepping in, unless you have to, but allow some ownership. That allows us to grow and expand and to stretch. And then also understand what motivates someone else, lean into the strengths, but also, almost more importantly, lean into even your weaknesses and gather resources or things that you can do to help improve in that area. And that doesn't have to come from a manager or senior level leadership. It can come from a colleague. And so it's important for us, in a previous life, I was an assistant professor and department chair of public health. And one thing I told my students was that as long as you have breath in your body, there's always an opportunity to learn and grow. It doesn't matter if you're 24 or 94. So it's important for us to think about how can we expand and grow in our roles, in our lives, and how that ends up impacting the lives that we touch.
Before we move into the last question and then open up to the audience, last question is about looking forward. I wanted just to circle back to the leadership and the long piece. You know, I grew up in an era where I was a big kind of superhero fan. And I love Superman. I love Superman, right? Bro, I love him. I love him. But the interesting thing about Superman, and I'm going somewhere with this, is we each have our own quality, our own talent, right? And if you have not found a way yet within this organization, or we have not given you an opportunity to tap into that talent, right, then you need to let me know, right? If you haven't been given an opportunity, let me know. We are creating pathways for people to try to it's not trying to exhibit their talents, right? I'm not talking about what you went to school for, right? I'm not talking about what's on your resume, okay? I would personally say my talent is an MC. No, seriously. I'm not talking about MC, EMC, right? I'm talking about MC. Come on, Christine, let them know. What does MC stand for? Kenny, where you at? What does an MC stand for? Move the crowd. Move the crowd. Right? I'm not talking about in this setting right here. Okay? Each of you, I hope, in some instant, some conversation in passing, more than just a brief minute, I've been able to articulate to you my purpose here, what I believe our purpose is here, and where you fit in and where you should go. And if you want to move forward, then come see me, right? The ability that we each have, my ability is that I can get 300 people, for the most part, to move in the same direction. Does that make sense? Beyond you being a doctor or a nurse, right? Or a builder or a coder, in IT, right? Or having a license for electrical work, or doing anything else we do here, right? Is what you bring, again, right? And so there's a reason why this theme is the power of you. Bring your talent, whatever your superhero talent is, here every day. It has a space and place, right? Whatever it is. If you're a master juggler, we're going to figure out how to use you as a juggler. You're going to have those pediatric patients lined up and laughing. We're going to charge them a couple bucks. But seriously, think about it. Think about what is tapping, what can you tap into from your own personality and experiences every day, well beyond your credentials, to make this a better place. Make it a better place. So anyway, looking forward to the future. As we think about the future of ACH, whether it's new technologies, patient partnerships, or community engagement, what excites you most about the direction we're heading?
There's a quote that says, if you're not learning, then you're stagnant. And if you're stagnant, then you're not evolving. And if you're not evolving, then obviously you're not progressing, right? And so I'm excited about being here today because this is a testament to Advance's commitment to growth and improving our overall quality of care. And so I'm looking forward to seeing how we will utilize everything that we've been learning and discussing today. As far as opportunities for continued growth, I think one, investing in our people and the talent that we have here. and helping to develop those strengths as well as improving those weaknesses. Two, I would say I'm looking forward to standardizing our processes because I know that will lead to better quality care, improve patient safety, and overall improve confidence in the care that we provide as a team. Three, I would say creating a workplace that actually supports well-being and preventing burnout. You know, we can't talk about preventing burnout if we don't have a system that supports that. So I'm looking forward to seeing ways that Advance will support us with that. And then for how we will continue to improve is that through with patient-centered improvements. So taking our data, reviewing that data, and continually growing using best evidence-based practices. And so I feel like whenever we come together and do those things, you know, we'll begin to talk about the good care that we can provide in the community. Other people will start talking about that care. And so then we'll move from just being a community clinic or a community health system to now being the pillar of communities that we're in. So I'm looking forward to that.
I want to circle back around to the burnout thing. I know you probably had a session about gurus about burnout and resiliency and my. I don't know you ladies too well, but we talk about this often. Just love to know the type of propaganda you were selling today. No, it was good. It was good. And I hope that we also meet the balance of the, you know, our direction and our future is only as good as the workforce that we have. And we have to be mindful of it. Thank you very much. Chad, what we can Chad, same question.
I think for me, the growth that we're looking at, if I know Scott likes to look at things strategically. But that tells me we're looking to grow in parts of the counties we're not in yet, provide more services that we're not providing now. And that sort of growth and opportunity for my team specifically to do more skill sets we're going to need to add. So that means training opportunities and learning opportunities for people on the team. So that's exciting for me.
For me, outside of growth, which is great, but a little scary with the current political environment we're in right now, I think the programs, like what Vann is doing with the health equity program that she's bringing in, I participated in that. I've lost like 25 pounds so far. Those are programs that involve our patients, and we can expand that to more of our sites. I think that will be something that can get our patients more involved. Also, the mobile health services, as we expand on mobile health services, one of the things we talked about in this morning's session, our collaboration into discipline action, is getting into the community, getting out there. Dr. Holloway talked about that, being that medical provider that goes to a visit. If we could expand, I think, our mobile services and actually have some advocates that are patients, homeless people, former homeless people that can go out there and advocate for these programs. I'm excited if we can do something to that along those lines, because I think we're going to meet our patients and it'll give opportunities to other staff members here that might want to be part of that may have experienced some of these things and can advocate it and bring them in and provide those services. I think as an organization, I'm looking forward to some of those.
Excellent. We're going to wrap it up. We're going to start heading into our afternoon sessions. Everybody knows where they should be going. But this was really good. Give our panelists another round of applause. So really good takeaways from each question, the structure of the questions today. What I'm encouraging each of you to do, there's a reason why these four were chosen. Pull their coattails, talk to them, talk to each other. I think the more we can have panels and sessions like this, either revolving around the organization or even carving out some time during our town hall, it's good to get perspectives from each of our team members. So great start today. Thank you for your work. move right into the after discussion. All right?